Good morning. This is our project for Civic Engagement Group project. Our webinar is about co-occurring medical and addictive disorders, and we are Group 3.
Now first, I would like to start by defining what co-occurring medical conditions are. Well, co-occurring disorders are also referred as dual diagnosis, which occurs when a patient is suffering from more than one medical condition. Specifically in terms of psychiatry and addiction, this makes reference when there is an addictive disorder coexisting with another physical disorder.
On the other hand, we have what addictive disorders are. Millions of people are exposed to addictive agents each year, and addictive disorders are characterized by changes in behavior, personality, and habits. They are influenced by intrinsic factors, which could be sex, age, or genotype, and more, and extrinsic factors, which is more like drug availability, the influences they have, and social support. Now, the relative importance of these factors varies across the lifespan and the different stages of addiction.
But now the question is, what are the general symptoms of it? Well, usually this occurs when a medical patient starts showing signs of psychiatric symptoms and seeking for treatment. Not identifying the patient's needs can be chaotic for them, since the interaction between different conditions can end up increasing the severity for both disorders. This is why it is important for doctors to manage both conditions appropriately in order to prioritize the individual's safety. Well, in comparison with the general population, it has been proved that people that suffer from mental health disorders have a higher probability of experiencing other mental conditions. Between people that suffer from any alcoholic disorder, there are 44% chance of getting any other psychiatric disorder, while for other drug use disorders, there is a 64.4% chance. The examples that we are going to talk about today include diabetes and addictive disorders, HIV and addictive disorders, and finally, mental disorders and addictive disorders.
Now we will talk about diabetes and addictive disorders. It is estimated that 11.3% of the U.S. population alone suffers from diabetes, and that 38% of the U.S. population is pre-diabetic. It is estimated that 10% of Americans suffer from an addictive abuse disorder, making the likelihood of diabetics being addicts or addicts being diabetics relatively high. In fact, the prevalence of addictive disorders among persons with diabetes is between 9.6 and 29%. There is even an association by several studies showing those who suffer from addictive abuse disorders develop type 2 diabetes more often than non-addicted counterparts. The comorbidity of diabetes and addictive disorders is problematic, since these individuals frequently use healthcare institutions and incur high costs as a result. There are various signs and symptoms of diabetics at varying degrees of severity and treatment, which include organ damage, nerve damage, and skin ulcers, paralysis, limb amputations, blood vessel damage, heart attack, stroke, atherosclerosis, and glucose-induced comas. A further complication, and one of the most troubling of diabetes, is the risk of diabetic ketoacidosis, which is characterized by abdominal pain, vomiting, dehydration, and sweet-smelling breath. Addictive disorders are characterized by changes in behavior, personality, and habits, and are signs of addictive disorders, as well as increased risk behavior. Co-occurring addictive disorders and diabetes is a troubling situation, since diabetics who abuse substances are at a high risk for advanced stages of disease and a myriad of complications, including those listed prior. Further complications unique among addicted diabetics are increased cell damage, decreased antioxidant potential of cells, because alcohol will typically reduce that metabolically, impacted glucose metabolism because of the damage to the liver, and poor diet choices. The most typical of these interactions that the two diseases threaten is hyper or hypoglycemia caused by respective substances. For instance, cocaine use causes hyperglycemia. Treatment can be challenging, since withdrawal symptoms are made harder to manage by the weakened body state of diabetics. They often experience symptoms of withdrawal more so, which can include body pain, sweating, fever, vomiting, nausea, diarrhea, and intense cravings, which further complicates blood sugar control. The typical treatment for diabetics with addictive disorders is the same as metabolically typical people with addictive disorders: psychotherapy and abstinence. Diabetes is incurable, but symptoms are manageable, and several interventions such as insulin supplementation can help control blood sugar. Integrated care models models have also been suggested, and close symptom management for those with severe diabetes and withdrawal symptoms under controlled settings should be advised. Diabetics are not necessarily incompatible with certain other methods of addictive disorder management, such as methadone, though close monitoring of their interactions is required.
HIV, AIDS, and addictive disorders. Introduction. Human immunodeficiency virus, HIV, is a virus that attacks the body's immune system. Acquired immunodeficiency syndrome, AIDS, is the most severe form of HIV. It is stage 3. HIV can be transmitted through the sharing of needles, which can occur by drug use. In Iran, 45.7% of HIV cases are caused by the injection of drugs. Prison is a key component to the spread of HIV due to syringe users. These statistics demonstrate the interactions between drug addiction and transmission of HIV. It is crucial to understand the relationship between the two in order to raise awareness and improve the rates of addiction in HIV. Signs, symptoms, and complications. HIV can cause symptoms identical to influenza, such as fever, chills, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. These symptoms can last from a few days to a few weeks and may also not be present in some individuals. Complications include the worsening of these symptoms. Additionally, delaying treatment can regress the immune system, put one at a higher risk for transmitting the infection to others, and develop into AIDS. Treatment. Therapy can allow those struggling with addictive disorders to cope with a positive diagnosis while also learning to curb addictive habits. While there is no cure for HIV or AIDS, treatment options consist of pills or shots. The different kinds of pills are FDA approved, are available as a single pill or a combination of medicines, and are recommended for those that are early on in their HIV infection. Injections can be considered for patients who have had an undetectable viral load or have been virally suppressed for at least 3 months. The most common side effects of treatment are nausea, vomiting, diarrhea, difficulty sleeping, dry mouth, headache, rash, dizziness, fatigue, and temporary pain at the injection site. Benefits of treatment. Treatment reduces the amount of HIV in the blood, also known as the viral load, and can do so up to the point to where it is undetectable on a test, thus preventing transmission to others through sex and likely reduces transmission through syringe needles. Additionally, it can lower perinatal transmission down to less than 1% depending on how long treatment has taken place and if HIV treatment is given to the baby. Overall, HIV can be prevented, and treatment options have been successful at lowering these transmission rates while providing professional support to an individual coping with a diagnosis. Harm reduction techniques can further serve in reducing the spread of HIV, provides more support, and properly educates those struggling with addiction.
So, for the last example, we will be discussing the co-occurrence of mental and addictive disorders. So the most common mental disorders to occur with addiction are anxiety and depression, although personality disorders like schizophrenia and bipolar disorder are also prevalent. Now, these two disorders have a high likelihood of co-occurring, and they're most prominent in adolescents and young adults. However, we must note that one disorder does not necessarily cause the other. So then, how does this happen? Well, both disorders actually have common risk factors, such as genetics, stress and trauma from childhood experiences, and other environmental factors. Now, as we previously mentioned,
One disorder does not directly cause the other. However, substance abuse can cause a mental disorder to develop, and a mental disorder can cause substance abuse to develop. So, one will not directly cause the other, but their developments are linked. Now, for the signs and symptoms of these two disorders, they include changes in eating or sleeping habits, depressed mood, fatigue, excessive worrying, irritability, difficulty concentrating, and suicidal thoughts. So, mainly the symptoms that point to the development or presence of either of these disorders are changes in physical appearance or personal care habits, changes in personality, or changes in personal relationships. Now, some complications between both of these disorders is that the mental disorder can make the addiction worse, or the addiction can make the mental disorder worse. For example, if someone is suffering with an addictive disorder, they may be hopeless or think negatively of themselves. Perhaps the attachment to the drug can cause their personal relationships to lose strength, causing them to feel more alone, in which depression can ultimately develop. On the other hand, if someone has a mental disorder like anxiety, they can turn to drugs to relieve the stress of social situations or to become more sociable. If someone is suffering from depression, they may turn to drugs to uplift their mood, and both of these scenarios can ultimately lead to the development of an addiction. People with a drug use disorder and a mental disorder often show resistance to treatment, as well as symptoms that are more persistent and severe compared to someone who's suffering with one of these disorders alone. Finally, the treatment of these co-occurring disorders. First of all, a new patient should initially be screened for substance use symptoms and screened for mental disorder symptoms, specifically through a mental health care provider or system. And the main treatment method for the co-occurrence of these two disorders is something called integrated treatment. And basically what this is a treatment plan that focuses on treating both disorders at once, rather than focusing on one or the other. Now, since these two disorders are highly prevalent in adolescents and young adults, interventions are highly recommended to prevent these disorders from worsening. This mainly looks like implementing support systems through either family, school, or the greater surrounding community. Treatment plans can include psychotherapy, which is talking about the mental disorder with a mental health provider, skill building to restore lost skills or develop new skills for success in life, illness management such as coping mechanisms and dealing with symptoms, behavioral therapies such as cognitive behavioral therapy, which aims to remove harmful beliefs and develop healthy coping mechanisms, dialectical behavioral therapy, which focuses on controlling emotions and preventing harmful behaviors, and assertive community treatment, which fosters a community of those suffering from the same mental health issues. Medications such as antidepressants or mood stabilizers, and medications to help curb withdrawal symptoms or to prevent relapse. Support groups also help establish community, as previously mentioned, and are a fundamental part of treatment. And finally, long-term treatment includes medical detoxing, residential rehab facilities, and aftercare, which is essentially a plan to prevent a relapse of addiction after treatment has been completed.
To conclude our webinar, I will be talking about the commonalities among different problems with comorbidity and addiction, the importance of spreading awareness, and resources for local treatment centers. First, comorbidity is when two or more disorders occur in the same person. Drug addiction and mental illness are the most commonly seen comorbidities that occur today. Addiction can change the way your brain works, leading to problems in the brain's ability to work correctly. Each section in the brain does a certain task, and certain drugs will harm certain sections of the brain, hindering a person's actions. However, mental health is not the only comorbidity that can be seen with drug addiction. As mentioned in our webinar, HIV/AIDS and diabetes are also commonly associated with addiction. Drugs will trick your brain into thinking you cannot live without it, resulting in comorbidity of drug addiction with HIV/AIDS when needles used to inject drugs into your body can be passed around, and it can spread to other people when one person uses it who is already infected with HIV/AIDS. It can also be seen in diabetes, and it can also be seen in mental health disorders, as again, addiction can change the way your brain works, and it can lead to problems with mental health. However, drug addiction cannot just lead to mental health. Those who also already have been diagnosed with mental health can also have a drug addiction because they believe that the drug can heal them, or the drug can change the way that their brain works and make them think that they are not as mentally ill as they think they are. This goes to show that spreading awareness of comorbidity is so important because it educates others on how common it is. Not many realize how common it is to develop multiple disorders at once, so spreading awareness to lower the commonality of comorbidity between drug addiction and other disorders is very important. In fact, we should be talking more about this since, again, people tend to assume that people who have mental health disorders are already drug addicts, when really the drug addicts might have mental health disorders because they are addicted to drugs, and vice versa. There are plenty of resources around the area that can help somebody with a drug addiction and help them avoid comorbidity, such as the Board Prep Recovery Center, White Sands Alcohol and Drug Rehab, and the Riverside Recovery of Tampa. These are all local centers in Tampa that would be able to help those who have been struggling with drug addiction avoid comorbidity and be able to help not only them but also their loved ones who are worried about them as well.